Necrotizing fasciitis is a rare but serious bacterial infection that requires immediate medical attention. It is often called the flesh-eating disease due to its rapid and destructive nature. This infection spreads quickly and aggressively in the body, causing severe damage to tissues. It attacks the fascia, which is the connective tissue surrounding muscles, nerves, and blood vessels, leading to widespread tissue death. Necrotizing fasciitis can affect any part of the body, but it is particularly dangerous when it affects the genital area, a condition known as Fournier's gangrene. This infection is caused by bacteria, most commonly group A streptococcus or group A strep, but other bacteria can also be responsible. Group A strep is a common bacteria, and many people carry it in their nose or on their skin without any symptoms. However, in rare cases, these bacteria can enter the body through a cut, scrape, or other breaks in the skin, leading to this severe and life-threatening infection. The disease can progress rapidly, often within hours, making it critical to seek medical help immediately if symptoms appear. Early symptoms may be mistaken for less serious conditions such as a minor skin infection or muscle strain, making timely diagnosis and treatment crucial to prevent severe complications and improve outcomes. Recent data from Shrewsbury and Telford Hospital NHS Trust has revealed a worrying trend, a significant increase in cases of necrotizing fasciitis affecting the genital area. While this condition has always been a concern, the recent spike in cases, particularly in a specific geographical region, has raised alarm bells among medical professionals. Although the exact reasons for this increase are not fully understood, several factors are suspected to be contributing to the rise. These include changes in bacterial virulence, increased awareness and diagnosis, and lifestyle factors that may increase susceptibility to infection. The data from Shrewsbury and Telford Hospital NHS Trust serves as a stark reminder of the potential severity of this disease. It underscores the need for heightened awareness, early diagnosis, and prompt medical intervention to improve patient outcomes. While the exact causes of the recent surge in necrotizing fasciitis cases in the genital area are still under investigation, several factors are believed to play a role. One possibility is the emergence of more virulent strains of bacteria. These strains may be more resistant to antibiotics or possess enhanced mechanisms for evading the immune system. Another contributing factor could be the weakened immune systems of individuals who have recently recovered from infections like COVID-19. Viral infections can temporarily suppress the immune system, making individuals more vulnerable to opportunistic bacterial infections. Furthermore, certain lifestyle factors such as smoking, diabetes, and obesity are known to compromise the immune system, increasing the risk of developing severe infections. Addressing these underlying health conditions is crucial in mitigating the risk of necrotizing fasciitis. Necrotizing fasciitis is a rapidly progressive and life-threatening infection. Once the bacteria enter the body, they multiply rapidly and release toxins that damage and destroy the surrounding tissues. This destruction of tissue can happen within hours, leading to severe complications. If left untreated, necrotizing fasciitis can lead to sepsis, a life-threatening condition where the body's immune system overreacts to infection. Sepsis can cause organ failure and death. In some cases, amputation of affected limbs may be necessary to stop the spread of infection. Section 5. Intimacy and infection. The role of grooming and sexual activity. While the link between intimate grooming, sexual activity, and necrotizing fasciitis in the genital area is not fully understood, experts believe that certain practices might increase the risk of infection. This is a complex issue that involves multiple factors, including personal hygiene, the presence of bacteria, and the condition of the skin. For instance, shaving or waxing the pubic area can create tiny cuts or abrasions that serve as entry points for bacteria. These small injuries, often unnoticed, can become gateways for harmful microorganisms to enter the body and cause serious infections. Similarly, rough or vigorous sexual activity can also lead to micro-tears in the delicate skin of the genital area, providing an opportunity for bacteria to invade the tissues. These micro-tears, though small, can be significant enough to allow bacteria to penetrate deeper layers of the skin. This risk might be higher if one or both partners have any open sores or infections in the genital area. Open sores can act as direct entry points for bacteria, significantly increasing the risk of developing necrotizing fasciitis. It's important to remember that necrotizing fasciitis is a serious but rare complication. Despite its rarity, the severity of the condition makes it crucial to be aware of the potential risks and take preventive measures. Practicing safe hygiene habits, being mindful of any cuts or abrasions in the genital area, and engaging in safe sex practices can all help to minimize the risk of infection. Regularly checking for any signs of irritation or infection and seeking medical advice promptly can also be beneficial in preventing serious complications. Section 6. Recognizing the signs, symptoms specific to the genital area. Necrotizing fasciitis can manifest differently depending on the location of the infection. When it affects the genital area, the symptoms can be particularly alarming. Early signs may include redness, swelling, and pain in the affected area, which can be mistaken for less serious conditions like a skin infection or an allergic reaction. As the infection progresses, the pain intensifies, and the skin may become discolored, turning purple or black as the tissues start to die. Other symptoms include fever, chills, nausea, vomiting, and a general feeling of being unwell. In some cases, blisters filled with fluid may develop, and the affected area may feel hot to the touch. Any signs of pus or a foul-smelling discharge from the infected area should be considered a medical emergency. Section 7. Early detection is key expert advice on diagnosis and treatment. Early diagnosis and treatment are crucial for improving the chances of survival from necrotizing fasciitis. If you experience any of the symptoms mentioned earlier, especially after an injury or trauma to the genital area, seek immediate medical attention. Doctors typically diagnose necrotizing fasciitis based on a physical examination, a review of symptoms, and laboratory tests. These tests may include blood cultures to identify the bacteria, imaging scans like X-rays or MRIs to assess the extent of tissue damage, and a biopsy to confirm the diagnosis. Treatment for necrotizing fasciitis usually involves a combination of potent intravenous antibiotics and surgical intervention. Surgery is often necessary to remove the dead and infected tissue, a procedure known as debridement. In severe cases, multiple surgeries may be required. Section 8. Preventing the flesh-eating disease, practical tips for staying safe. While necrotizing fasciitis is a serious condition, there are steps you can take to reduce your risk of infection. Maintaining good personal hygiene is paramount. This includes washing your hands frequently with soap and water, especially after using the bathroom and before and after handling food. If you have any cuts or wounds, keep them clean and covered with a sterile bandage until they are fully healed. Avoid sharing personal items like razors, towels, and undergarments, as this can spread bacteria. If you have diabetes, it's essential to manage your blood sugar levels effectively, as uncontrolled diabetes can weaken the immune system. Similarly, if you smoke, quitting smoking is one of the best things you can do for your overall health and to reduce your risk of infections. Section 9. A call to action, raising awareness for timely intervention. Necrotizing fasciitis is a rare but devastating disease that requires urgent medical attention. This aggressive infection can spread rapidly, destroying skin, fat, and the tissue covering the muscles. Without timely intervention, it can lead to severe complications, including death. Raising awareness about this condition among both healthcare professionals and the general public is crucial for promoting early diagnosis and timely treatment, which can be life-saving. Public health campaigns and educational programs play a vital role in spreading knowledge about the symptoms and risks associated with necrotizing fasciitis. Medical professionals need to be vigilant in recognizing the signs and symptoms of necrotizing fasciitis, especially in its early stages when it can be mistaken for other less serious conditions. Early symptoms may include sudden pain, swelling, and redness at the infection site, often accompanied by fever and chills. Prompt diagnosis and aggressive treatment are essential for improving patient outcomes. This often involves surgical intervention to remove infected tissue, along with antibiotics to combat the infection. The sooner the treatment begins, the better the chances of recovery. The general public also needs to be aware of the potential risks and symptoms of this disease. Understanding the early warning signs can lead to quicker medical consultations and interventions. Understanding the importance of good personal hygiene, proper wound care, and seeking immediate medical attention if any concerning symptoms arise can make a life-saving difference. Simple practices like keeping wounds clean and covered and monitoring for signs of infection are crucial. Remember, early detection and prompt treatment are crucial for surviving this silent epidemic. By staying informed and proactive, we can all contribute to reducing the impact of necrotizing fasciitis.